Hi, I'm Sarah Shannon, and it's my pleasure and honor to present tonight's first award, the Distinguished Section Service Award, which honors outstanding service to the International Health Section. This award recognizes dedication to the International Health Section mission and goals as demonstrated through exceptional contributions to our section activities. It's awarded to an individual who has served in section elected positions or by chairing a committee with outstanding or unusual effort and achievements, and who has done so showing excellence in teamwork with peers in our section and within the APHA. I am so very pleased to present the 2020 Distinguished Section Service Award to Laura Arnson. As our section secretary, Laura has been and is a true servant leader, providing behind-the-scenes assistance, organization, real-time note-taking, and follow-up, not just to me as section chair, but to the entire section leadership and members. Laura cheerfully steps in to help out where help is needed and proposes ideas and solutions to problems before most people even notice that they were problems. A few and notable above and beyond actions. In 2018, shortly after becoming secretary-elect, Laura filled in for a year for the maternity leave of our section secretary at the time. And if something has run smoothly at this annual meeting, chances are that Laura had a hand in helping make that happen. But I also want to recognize that Laura did all of this while being a full-time PhD student, and on top of that, teaching, and on top of that, now doing a challenging job. Laura is modest about her extensive global health background, but here are just a few tidbits. She's worked with Save the Children, UNICEF, USAID, and many other organizations, working in or supporting work in at least 14 countries that I could count, Afghanistan to Zambia and everywhere in the world. With gratitude for her many contributions, I present the 2020 Distinguished Section Service Award to Laura Arnson.
Hi, I'm Laura Arnson, the Secretary of the International Health Section. I want to say thank you for this award. It means a lot to me. I am in awe of all of the work the International Health Section does in policy and advocacy, climate change, maternal health, and all the other activities. And receiving this award tells me that I must be doing something right in the way I try to support the section and the work of everyone in it. So again, thank you very much.
Hello, I'm Rose Schneider, Chair of the International Health Section's Climate Change and Health Working Group. I'll be presenting the Young Professionals Award in International Health. This award recognizes young professionals for their leadership, innovations, and demonstrated contributions to the international public health field. The evaluation criteria are three: demonstrated contribution to the field of international health through leadership, innovation, and impactful practice. Number two, age younger than 35 years. Number three, current membership in the APHA section. I'm pleased to announce this year that the winner is Jessica Corrales. And who is Jessica Corrales? Well, she's a young professional, but she has a long track record and lists of accomplishments. A few of these are from the 2012 to 2014, Jessica worked on a large research project in China, funded by DFID, which resulted in the publication of the book, Climate Change Adaptation in China. From 2015 to 2018, Jessica led the International Health Section's Global Health Job Analysis team, which published the analysis to date on the skills and experience needed for global health employment sector. In 2015 to 2018, Jessica worked on the issues of HIV/AIDS related immigration restriction on South Korea. This resulted in an improved APHA policy against HIV/AIDS related travel restrictions in South Korea, and also a World Public World Federation Public Health Association policy against broader HIV/AIDS related travel restrictions. From 2018 to 2020, Jessica served as co-chair of the program committee for the international section, assembling scientific programs for the APHA annual meetings. She's also done 8 presentations at APHA and published or contributed to 9 publications. For this reason and many others, I'm pleased to present now Jessica Corrales, who will say a few words to accept this award.
Greetings from quarantine, everyone. I am honored to accept the Young Professionals Award from the International Health Section and, more importantly, thrilled to learn that I am still young. When Mark Strand reached out to me to let me know he was putting my name in the hat for this award, my first reaction was, do I still qualify? I felt a professional responsibility to verify that I had not passed the section's age cutoff for being young before providing my CV. I was pleasantly surprised to learn that I still am, but only for another 28 days, as I turned 35 right before Thanksgiving. So I qualified for this award by the skin of my teeth. A 1-minute speech is short indeed, so I will close by thanking Dr. Strand for nominating me, the awards committee for their careful deliberation, and for the recognition of the work I do through the section to push the needle toward health equity for all. Oh, and for making me feel young, for a brief moment, despite this year warping our perception of the passage of time beyond all recognition. Thank you all, and good night.
Hello, everyone. Lovely to join you all at this award ceremony for the International Health Section. I'm Laura Altobelli, past chair of the International Health Section and chair of the awards committee. And I'm very pleased to be able to announce the criteria and the winner of the Mid-Career Award. The Mid-Career Award of International Health recognizes an outstanding mid-career professional in the International Health Section. The evaluation criteria include a demonstrated achievement and commitment to international health promotion and development over a suggested period of 7 to 20 years. Demonstrated creativity in expanding the concepts pertinent to the practice of public health with an international focus, and current membership in the APHA International Health Section. The winner of the Mid-Career Award in International Health in 2020 goes to William E. Rosa, PhD, NPBC, FCCM, FAANP, FAAN. To mention the highlights of Dr. Rosa's career in international health, he worked in Rwanda for the Healthcare Capacity Building Initiative Human Resources for Health, where he served as a lead faculty member for the country's first graduate level program in nursing, and as a clinical educator in the Rwanda Military Hospital Intensive Care Unit. He is the lead researcher currently for the 2020 WISH International Policy Report, focused on nurses and midwives achieving health equity through action on social determinants of health. Dr. Rosa's award-winning book, A New Era in Global Health, Nursing and United Nations 2030 Agenda for Sustainable Development, is the definitive text in his discipline for achieving public health equity through the SDGs worldwide. I'll have to read that book. And I'm very pleased to pass this over now to William E. Rosa, who will say a few words.
Hi, my name is Billy Rosa, and I just want to say how grateful I am to the International Health section of the APHA for the Mid-Career Award in International Health. I think we can all agree that never before has the mission of the APHA been so important to improve the health of the public and also the health equity status of the public around the world. And I'm so grateful to the International Health section for the work you've been doing throughout the pandemic and throughout this increased visibility of social injustice in the US and worldwide. Thank you to the award committee and to Teresa Majeski for nominating me. And I just want to share this poem that I hope will leave with some inspiration by Clarissa Pinkola Estes called You Were Made for This. And she writes, in any dark time, there is a tendency to veer toward fainting over how much is wrong or unmended in the world. Do not focus on that. We are needed. That is all we can know. One of the most powerful and calming actions you can take to intervene in a stormy world is to stand up and show your soul. Soul on deck shines like gold in dark times. When a great ship is in harbor and moored, it is safe, there can be no doubt, but that is not what great ships are built for. Thank you again. Please stay well, stay healthy, and take good care.
Hello, everyone. I'm Dr. Henry Perry, a member of the awards committee and also a faculty member of the Johns Hopkins Bloomberg School of Public Health. It is my great honor to present the 2020 Gordon Wyan Award to my dear friend and colleague for the past 3 decades, Dr. Paul Freeman. Paul began his career in international health working in Central Australia with the Aboriginal people 4 decades ago. Following that, he served in Papua New Guinea, in Laos, Vietnam, and other countries in Southeast Asia, and also in Africa. Beginning in 1993, Paul and I worked together with our mentor, Dr. John Wyan, for whom this award is named in part, in the formation of our section's working group on community-based primary health care, which Paul chaired from 2008 to 2011. Paul and I led a comprehensive review of the effectiveness of community-based primary health care that resulted in the publication in 2017 of a book and also 9 peer-reviewed articles. Paul served as section chair from 2012 to 2014, as well as chair of the section's award and finance committees. The Gordon Wyan Award for Excellence in Community-Oriented Public Health, Epidemiology, and Practice is named in memory of Professors John Gordon and John Wyan, who were pioneers in involving communities in the work of public health and in collecting local epidemiological data for designing, implementing, and evaluating health programs. Ray Martin, who formally nominated Paul for this award, and I could not be more delighted that the section has chosen Paul to receive this award. Paul is richly deserving, and we congratulate him for his many contributions, not only to community-oriented public health, but also to our international health section and its many activities. Thank you and congratulations, Paul.
I am honored to receive the Gordon Wyan Award for Community-Oriented Public Health Epidemiology and Practice. I thank Ray Martin for nominating me for this award and the members of the International Health Awards Committee for selecting me for it. I especially thank all the members of the communities throughout the world I have worked for. There is now a good evidence base that community-based primary health care is effective. However, there remains an ongoing need for greater community involvement and ownership of all stages of the management of their health and health care. Without this involvement, lasting improvements in health and health care cannot be achieved at this level. Thank you.
Good evening, everyone. My name is Omar Khan. I'm a former chair for the section of International Health, and it is my distinct honor and pleasure to introduce to you this year's awardee for the Carl Taylor Lifetime Achievement Award. This award in international health honors the visionaries and leaders who have shaped or continue to shape the direction of international health. Dr. Carl Taylor, my former professor as well, was the founder of the APHA International Health Section and a pioneer in and global champion of international health in the 20th century. The evaluation criteria for this award include quality, creativity, and innovativeness of the individual's contributions to the field of international health, application of the individual's work to international health practice, and the individual's contributions as a leader, a visionary, and role model in international health, and of course, current membership in APHA and in the international health section. I am pleased to introduce to you this year's winner of the Carl Taylor Lifetime Achievement Award is my friend and colleague, Dr. Gopal Sankaran. Dr. Sankaran has earned his MD degrees, his MPH, and his DRPH degrees. His list of qualifications is certainly extremely lengthy. I'll just cover a couple of highlights here. I want to mention, first of all, how exceptional contributions for Dr. Sankaran have been to the section of international health. Certainly for as long as I've been involved, Dr. Sankaran has served in an amazing diversity of roles in international health, reflecting his commitment not only to our section, but also to APHA and to the field at large. He currently serves as a professor in the Department of Health at Westchester University. He has served in many leadership capacities at that university as well, including as Assistant Vice President of International Programs. Dr. Sankaran has many achievements to his name, among which, for example, is developing with Dr. Jonathan Mann the first epidemiologic model for the World Health Organization to assess the magnitude of HIV-infected children in sub-Saharan Africa. Within his state, Dr. Sankaran is extremely active. He is the Commonwealth of Pennsylvania delegate to the United States Global Leadership Coalition. Within APHA, he's held a variety of leadership roles as well. Currently, he serves as the chair of the editorial board of the extremely prestigious American Journal of Public Health. He also has served on the governing council of APHA, and again, as I mentioned, has served such a wonderful diversity of roles across both the section, the association, his state, his community, and his university. Please join me in thanking and congratulating Dr. Gopal Sankaran for being this year's awardee for the Carl Taylor Lifetime Achievement Award. And I'm now going to turn it over to Dr. Sankaran to say a few words about this award. Thank you very much.
Good evening. I thank Dr. Mark Strand, my nominator, and the International Health Section for bestowing this honor on me. I always recall two nuggets of wisdom from my mentors. Firstly, there's an I in international health, but no work in the field has ever been accomplished by a single individual. I accept this honor on behalf of countless people who have contributed to my education, growth, and professional work. Secondly, when I entered public health 4 decades ago, I was told that to be effective, one should have the eyes of an eagle, the heart of a lion, the skin of a rhino, and the soul of a saint. I give a special shout out to all students and young professionals, as they are the future custodians of our planet. Our planet is in good hands, for they possess the traits necessary to be effective. I applaud and salute them for what they are to accomplish in their lifetime. Finally, thank you all for the Dr. Carl Taylor Award that I accept with great humility and much gratitude.